So perhaps your baby has got some feeding problems. Perhaps they're being sick a lot, perhaps they seem uncomfortable, they seem like they're in pain, and you're not sure what's normal, what's not normal, and perhaps you've heard about different feeding problems and you don't know if this could be what your baby has. Even as a mum and a doctor, I still got confused myself. I had 2 babies who were fine and a third who was a total puker, and I wasn't quite sure what to do. So I'm going to go through all the different sorts of different feeding problems there may be, and hopefully by the end of this video you'll feel a lot more confident what to do, what to look out for, when to worry and when not to worry. Okay, first things we'll talk about cow's milk protein allergy. This is actually one of the most common food allergies in babies. In fact, about 7% of babies have it, and most of them do grow out of it. There are 2 different types we think about. So for some babies, as soon as they have any cow's milk, they have an immediate reaction in the next few minutes. So we call this IgE mediated, and that tends to be a bit more severe. For most babies, they have what we call non-IgE mediated. So that means that it can last hours or days even after they've had that cow's milk protein, which can make it a bit trickier to diagnose. So what are the symptoms of cow's milk protein allergy? Well, they can be really varied, which makes it hard to diagnose. So typically we think about they can have skin problems. So they might have an itchy rash, they might have swelling around the mouth, around the eyes, they might have eczema. They can have respiratory symptoms, so a bit like hay fever. They can be snuffly, a bit wheezy, have a runny nose, and they can have digestive problems. So they can have constipation, they can have loose poo, they can have colic, vomiting. So it's really varied and wide-ranging. And in some severe instances, this can lead to actually an anaphylactic reaction. So that's where there's a very severe allergic reaction. So if you think there's any breathing difficulty or the swelling of the tongue and the airways and the mouth, then don't mess around and do call 999. Even if you think they might be getting better, if you think that could have occurred, best to get checked out straight away. But that is rare, and for most children that won't happen. Okay, so management for cow's milk protein allergy. So this ultimately is about removing that cow's milk protein from the diet for about 2 to 4 weeks and seeing if there is an improvement of symptoms. So this does occur less often in breastfeeding mums, but it can happen. So if you're a breastfeeding mum and you're worried about CMPA, then you have to remove all dairy from your diet. And with my 3rd pukey baby, I tried doing this, and it's quite surprising how milk protein gets in lots of food and drinks. You have to cut out wine. That was a learning for me. So if you're breastfeeding, you cut out dairy from your diet for about 2 to 4 weeks and see if there's an improvement, and then you have to bring it back in to test it. So we call it like a challenge. If you've got a formula-fed baby, then you need to go to your GP surgery because you need a prescription formula. They will start with something called an extensively hydrolyzed formula. And then if it's very severe or that's not helping, they'll move on to an amino acid formula. So these formulas are just like normal formula, except that milk protein is broken down into a much more digestible form. They can taste and look different to normal formulas. They can smell a bit funny, but the babies don't tend to care. They haven't got taste buds like we do, so don't worry too much about that. Actually, it can also make their poos a bit greener, a bit darker, a bit runnier. Again, that's kind of normal, so don't worry too much about that. Make sure you're using the right amount of powder and doing it as per the instructions. And make sure that you do get prescribed enough, because obviously it's prescription only, you can't buy it over the counter. So you also have to try that for like 2 to 4 weeks. And then if there's an improvement, then you have to re-challenge with the normal formula again. And if then the symptoms come back, then that confirms the cow's milk protein allergy. If it's quite straightforward, then we can manage it in primary care, but sometimes we do also refer to the paediatricians or the dietitians if we're uncertain or if there's any problems. And if they don't get better, then obviously we'll think again, maybe there's something else going on. Okay, so something else. What about lactose intolerance? Loads of new parents come and say, I think my baby has lactose intolerance because, you know, they seem unhappy, they're pulling up their knees a lot, they're struggling with feeds. Actually, primary lactose intolerance, so that is with babies have primary lactose intolerance as soon as they're born or straight away, is really, really rare. So the lactose intolerance that can happen is after a bout of tummy upset. So gastroenteritis can cause a very short-term intolerance to lactose. So if your baby's had a bit of a tummy upset and then still got runny poos for kind of another couple of weeks, it may be they've developed a lactose intolerance. And you can buy over the counter some lactose-free formula. If you're breastfeeding, you just carry on as normal breastfeeding. And then this lactose formula may improve the symptoms, and then after a few weeks try back on the normal formula and it should settle back down. So lactose intolerance, a lot of people worry about it, but just remember, it tends to be just after a bit of a upset tummy, and it's very short-lived. So for a few weeks you might want to buy the over-the-counter lactose-free formula. It's usually about the same price, and then try again with your normal formula. If they still haven't got better after about 8 weeks, then again, let's look and see if there's something else going on, because maybe that lactose intolerance isn't the problem. So could the problem be reflux? Again, this is a really common thing that parents and caregivers worry about with their babies. So babies are not like adults. Their little tube pipe from their stomach is really floppy, and they have a tiny stomach. So when babies are born, their stomach is the size of a cherry. So if you imagine how much milk we're giving them, it's not surprising that lots of it comes back up as like a posset. And it doesn't bother them. They're usually pretty happy. They just blur it all back out. So we call them like happy pukers. So the main thing to think is, even if you've got a pukey baby like I did, if they're putting on weight and they're otherwise well and quite happy, then try not to over-medicalise it. You don't really need to go and see your GP. Just let them puke and we'll figure out, and I'll give you some more advice about how to help. But essentially, don't worry too much. Obviously, if they're not putting on weight as you would expect, or they seem really distressed with it, that's when you need to come and get some help. So what should we do about reflux? Well, typically they seem unhappy, they're puking, they might be uncomfortable during feeds, they might even have food avoidance where they're trying to push away the bottle because it's become uncomfortable for them. Often it's because we are overfeeding them, if it's a formula-fed baby especially. So often we say, oh, they're hungry babies, but they like the suckle, so it tends to be that they're not necessarily hungry, they just want to have that comforting suckle again. And then we give them too much milk, so they end up bringing loads of it back up. So just have a think about how much they do need for their weight and their age, and make sure you're giving them the right amount of formula. And best off giving smaller amounts more often, and then it's more easy for them to digest it with their tiny little stomachs. So that's the first thing to do. If that isn't working, the other thing, you can buy over-the-counter a thickener to go in the formula. This stops it from so easily flooding back up into the mouth. If the thickener still isn't working, then that's the time to go speak to someone at the GP surgery and see if you can get some help. Often we'll give an alginate, such as Gaviscon, which can again help settle the stomach. You may have friends or relatives who tell you to raise the head of the bed or the cot. Actually, don't try and do this. That can be quite dangerous. So make sure they're laid flat on their back, as per the recommendations for safe sleeping. Other things you can do to help is try and keep them upright after a feed. So I found just popping them in a sling is really comfortable, and then they quite like the pressure as well, and you can just get on with jobs as well after you've given them a feed. But essentially try and keep them upright for about at least half an hour after a feed. Make sure you're burping them frequently during the feeds, especially if they're bottle fed, and again just reducing that feed. And sometimes maybe a dummy might help if they're just constantly wanting the bottle but perhaps they're not hungry. So lots of tips, and obviously speak to your health visitor. They're going to have lots of tips on this. There may be a baby feeding cafe near where you live. If you're breastfeeding, you might want to get some breastfeeding to support. So there's lots of support out there. Essentially, don't worry by yourself, and you can always come and speak to us at the GP surgery if you're unsure. And finally, maybe your baby has colic. Now, again, as a mum and a doctor, I've kind of wanted to find out what colic is, because you hear about people talking about it, but it's not quite clear what the problem is. And actually, we're not quite sure really either what is colic, or if there is an actual thing. What we do say is that if your baby's crying for at least 3 hours a day, 3 days in a week for at least a week, then it may be they've got colic. So often they'll be going red in the face, they'll be bringing their legs up, they'll be looking unhappy and obviously crying. And there isn't actually a treatment for colic. You can get things over the counter like gripe water, you can get Infocol, people try different things like that. There's not great evidence for that. People also spend lots of money on cranial osteopathy to have their spine aligned. Again, no evidence, and I would say don't spend your money on that personally. But actually what does help is all the simple things that it's difficult when you're busy, but it's the kind of rocking your baby, keeping them close, cuddling them actually for 10 hours a day, and feeding them on demand has been proven to reduce crying by about 50%, which isn't always easy. Again, I would say maybe a sling is really helpful for that, to get on with normal life, especially when you've got other children or you're working and you've got the house to look, there's a lot going on in life, isn't there? But also a crying baby, I think this is the key thing to get across, is really hard on your mental health and your well-being. Especially maybe if you're a single mum, or you're having relationship issues, or you've got, you know, other children with problems. Or, essentially, it's really hard. So what I would say is make sure as a caregiver or a parent you get help. Because we need to acknowledge that it's really difficult, so don't kind of struggle along and, you know, you're meant to have this angel baby and pretend that everything's wonderful, and it isn't always. So definitely get help, and we can also find out if there's anything else going on with the baby. A lot of the time people might say that it's colic and actually it's reflux, or actually it's cow's milk protein allergy. So we need to look into it, as well as make sure that you are okay. I'm going to put a link at the end for a really good charity spot. They've got a free phone number. It's called Crisis. That's cry as in C-R-Y, Crisis. And that's for parents who may be struggling with a crying baby. So do reach out and get help. Okay, so the main thing to get across is that if your baby is putting on weight and is happy otherwise, but they just happen to be puking a lot, or are you worried about them making funny noises, then most of the time they're fine and we can be reassured. There are certainly some things that I would want you to look out for and get immediate help for. So I'm just going to run through what they are. So if your baby has got green vomit, like bile vomit, that needs checking out straight away. If there's any blood in the vomit, or they are projectile vomiting, so really going quite a distance. If they have any blood in their poo, or they've got a very swollen and tender tummy. If they've got a very high temperature, or they're feeling very shivery. If they keep being sick and they're really struggling to keep fluids down, especially if they're not having so many wet nappies. If they've got diarrhea for over a week and they're looking like they might be a bit dehydrated. If you just can't stop them crying, or they've got high-pitched cry and they're just really distressed and inconsolable. If any of those things are happening, then do get help. Either call 111, try and speak to your GP, or if you're very worried, then get yourself to A&E to get checked out. Okay, I hope you found that really helpful. I hope it's answered some of your concerns and hopefully reassured you a bit as well. But I think the main thing is, do get help. There's loads of help and support available. As I've said, the health visitor is usually the first pot of call for these things, but we GPs are always happy to speak to mums and dads and caregivers, and ultimately we trust your judgment as well. So if you're concerned, you think something's wrong, we're going to take that seriously. Okay, thanks so much for watching. Hope you found it helpful. Do share with anyone else who might find it helpful, and have a look at my other videos.